What to expect during radical nephrectomy recovery. If you or a loved one is facing a radical nephrectomy, you might be wondering what the recovery process looks like. This surgery involves removing an entire kidney, often due to kidney cancer, and the recovery can vary from person to person. Generally, recovery takes between 3 to 12 weeks, depending on several factors, including the surgical approach and individual health. After the surgery, most patients will stay in the hospital for 1 to 5 days. During this time, healthcare providers will closely monitor vital signs like blood pressure and fluid balance. You may have a urinary catheter placed during the procedure, which is typically removed the day after surgery. Initially, you might need to stick to liquids for a day or two before gradually reintroducing solid foods. Pain and discomfort around the surgical area are common, especially near the diaphragm. This discomfort can make deep breathing feel challenging. To help prevent complications like pneumonia, you will be encouraged to practice diaphragmatic breathing exercises. Walking is also important and usually starts the day after surgery. Walking helps improve blood flow, reduces the risk of blood clots, and aids in healing. In the first 2 weeks, aim to walk multiple times a day on flat surfaces. You might notice that your energy levels are low at first, and fatigue is a common experience for several weeks. It can take anywhere from 3 to 6 months for your energy to fully return. Other temporary symptoms may include nausea, diarrhea, constipation, gas, headaches, and general tiredness. If you undergo a laparoscopic or robotic-assisted nephrectomy, you may be able to resume light activities and return to work within 4 to 6 weeks. However, if you have an open radical nephrectomy, your recovery may take longer. Full return to normal activities, including heavy lifting and strenuous exercise, is typically expected around 8 to 12 weeks after surgery. During your recovery, it is crucial to avoid heavy lifting and strenuous activities for at least 4 weeks. You can usually start driving again once you are no longer taking narcotic pain medications and have regained full mobility in your waist. In the long term, your remaining kidney will generally adapt by growing larger and stronger, allowing you to live a normal life with just one kidney. Regular follow-up care is essential to monitor kidney function and check for any potential recurrence of cancer. Having support from family or friends during your recovery can make a significant difference, especially since your mobility and energy may be limited. It is important to discuss your personalized recovery timeline and care plan with your healthcare provider, as individual health status and the specifics of your surgery will influence your healing process. In summary, recovery from a radical nephrectomy involves a hospital stay, a gradual return to activities over weeks to months, managing pain and symptoms, and ongoing monitoring of kidney health and cancer status. Remember, walking, breathing exercises, and avoiding heavy exertion are key components to a safe recovery. Always consult with your healthcare provider for personalized medical advice.